Hello, everyone, and thank you, first of all, for the invitation to present the main results and recommendations from the EATG's mental health survey. I have no competing interests to declare, and to give you a bit of background, the survey is part of our mental health project and was based on the findings of a literature review that was conducted between February and August 2020 on the mental health of people living with HIV in Europe. It is an exploratory cross-sectional survey that targeted two groups. On the one hand, people living with HIV, and on the other hand, people working in HIV organizations in the WHO European region. It was launched in International Mental Health Day in 2020. It was open for 3 weeks for responses, and it was available in 7 languages to facilitate participation from people from different countries. The objectives were to provide an overview of the existing landscape of mental health issues, as well as services available in HIV organizations in the WHO European region, as well as to explore the self-reported mental health status, symptoms, and the impact of HIV and mental health, as well as access to mental health services amongst people living with HIV, also in the WHO European region. The survey was composed of 48 questions. You can see the split here. There will be links for the full survey report in the end of the presentation if you want to dive in depth on the different questions that were asked, as well as on the analysis. And so I will run you through the key results, obviously completely available for questions and clarifications in the end. So we start with the respondent distribution, and as you see, we had from the EU, EEA countries, we had a total of 389 respondents for people living with HIV and 187 for people working in HIV-related organizations. As you can also see, these represented mostly a few countries, and so representation is quite varied across the responding countries. In the non-EU EEA countries, there was a total of 257 people living with HIV responding and 172 people working in HIV-related organizations, for a grand total of 646 people living with HIV responding in Europe and 359 people from HIV-related organizations. So we'll start with the results from people working in HIV-related organizations. And one of the questions was, which were the most commonly raised issues related to HIV and mental health? As you can see here, these are the most mentioned, and you see that over 50% of respondents report mentions of depression, anxiety, isolation, shame, and close to 50% around self-blame and low self-esteem. And depending on the side of the region, even over 50%. You also see that quite a high percentage of respondents reported suicidal feelings as being commonly raised. Regarding the services provided, you see that peer support was the most commonly provided service in both sides of the region, closely followed by psychological support, and then self-help groups. Therapy sessions were much lower than these 3 in both sides of the region. And regarding the services that people consider are missing, you see that therapy as well as psychological support, but also referral systems are mentioned by a large percentage of participants. You see the difference between the EU and non-EU countries in terms of the distribution of the services that they consider being missing, with the non-EU countries reporting a higher percentage of people reporting therapy to be considered missing, as well as psychological support, but also referral systems, who were, on the other hand, more mentioned in the EU EEA countries. During the COVID-19 pandemic, unsurprisingly, over half of the people who responded reported that mental health issues increased in their work context, so reporting of mental health issues has increased. And so we asked what type of psychosocial support was provided to people living with HIV during COVID. And you see that there are quite some differences between EU and non-EU countries. Specifically, for the EU countries, apologies. So for the people providing usual psychosocial services, the services that they were already providing before, mostly we have online psychosocial support and referrals, as well as some people providing online therapy services. Whereas as those who are providing new services, so not their usual ones, you have quite a large amount of respondents reporting that they started to provide referrals to mental health support services, as well as online peer support and online psychosocial support. So there was an increase in offering amongst those who were not providing support prior to COVID-19 for mental health support for people living with HIV. Now, we pass on to the responses from people living with HIV. And to give you an overview of the sample, these were mostly cisgender men and women, self-identified as either heterosexual or gay and lesbian, and living mostly in capital cities or other big cities. Over 60% of the sample was between 30 and 49 years of age, and most respondents had high school level or a higher education, most frequently university or college level. Majority of respondents were employed and either rent or own their house, which means that we have in this sample quite a lack of representation from the most marginalized and excluded populations, which is one of the limitations of the survey. We asked people if they have had diagnosis or experience of symptoms of mental health disorders, both prior and post their HIV diagnosis. And as you can see, there's quite an increase from those who reported yes before and after their HIV diagnosis, which hints at the fact that HIV does have an impact in the mental health of those living with the infection. Additionally, we asked people if they had ever had a mental health examination, and if yes, when. And as you see in the UEA countries, and almost 50%, so 47%, almost half of the sample never had a mental health examination, and even more in non-EUEA respondents, with 64.8% never having had a mental health examination. Additionally, people, for the most part, did not ever really visit a specialist to address mental health issues, which obviously relates to the fact that many of them had never had a mental health examination done. But you see that the percentage of people who have ever benefited from either therapy or even, whether it is a private therapy or therapy through HIV organizations, which is so community supported therapy, let's say, or supported by community organizations, even with mental health consultants, is very reduced. The one smaller exception is that several people reported that they have had access to peer consultants through community organizations, mostly in the non-EUEA countries. But the vast majority of people have never used or have never visited a mental health specialist, over 60% in both sides of the region. So who do people ask for help? Most people, or most respondents, reported that friends or family are their most used sources of support. Friends are more reported than family, but the sum of these two goes to around 60%. You see that the percentages of people resorting to other sources of support is extremely reduced, with the exception of social workers and psychologists, which have around slightly over 20% of the sample reporting to have resorted to these sources. Regarding availability of mental health services, over 40% of the sample reports the existence of mental health services in their city of residence. But you can see that 38.3% in the EUEA countries and 28.4% in the non-EUEA countries report that they do not know if there are mental health services available in their city of residence, which is concerning, especially given the fact that many people, as you recall, have reported symptoms or diagnosis of mental health issues. We also compared these responses, so we compared the services who reported to be available with the report that people who work in HIV organizations provided us of the services that they make available in the different in their different contexts. And you see that there are big differences between what is reported by people living with HIV and what is reported by people working in HIV organizations. And although there are some limitations that we can discuss further in terms of the responses or the analysis of these responses, so they are not directly comparable, the rates of report of several of these services are half. So half of the people percentually report existence of these services when compared to the report from people working in HIV organizations. And similarly, you see that 50% of respondents from EU EA countries and 33.5% from non-EU EA countries report that they do not know if there are available services in HIV community organizations. Regarding difficulties in accessing treatment, you see differences between between EU EA countries and non-EU EA countries that are quite noticeable. You see that a little under 20% of people who reported to having been in treatment or in therapy in the EU countries report difficulties accessing treatment, whereas this percentage is 32.73% in non-EU EA countries. We decided to separate because those who reported never to have been in treatment or in therapy are quite a different sample and have probably not necessarily looked for it. And so reporting difficulties in access needs to be interpreted differently. But you see that despite this, there is still quite a considerable percentage of people reporting difficulties accessing treatment. We also asked a few questions that are generally asked to screen for the need of a mental health examination, specifically for depression. So we asked for people to report symptoms commonly associated with depression. You can see the more detailed analysis in the full report, but I'll highlight that 50.9% of respondents, if we use the factors included in the left side diagram, and 53.3% of respondents using the factors on the right side diagram would benefit from more thorough mental health assessment specifically for depression. And so as you see, there's quite a big number and quite a big percentage of people who would benefit from accessing a more thorough mental health assessment. We also asked about the impact of HIV and HIV stigma in mental health and some key life dimensions. And you see that in all of the questions, you have half or over half of people reporting that HIV had an impact in key dimensions of their lives, including over 67% in EU respondents and over 56% in non-EU respondents that report that HIV stigma and discrimination had a negative role in their mental health or their well-being. We also asked regarding mental health support received during the COVID-19 pandemic, and as you see, over 60% of respondents reported not having received any support during the COVID-19 pandemic. To wrap up some of the recommendations, we will have available a document with recommendations for specific stakeholders, but generally speaking, we obviously recommend raising awareness regarding mental health issues among people living with HIV, increasing coordination between mental health services and other HIV services, integrating mental health support in HIV care as much as possible, increasing dialogue between specialists from both sides, from HIV and mental health. And we also recommend that there are multiple options for people to access mental health support. Not everyone is comfortable with the same type of options, of course. And so diversity of responses would be extremely important. Naturally, that updates to policies and guidelines are very welcome. And we've been seeing an increase in the relevance of mental health overall, but there still is a need for a lot of work in the field of mental health, as well as in generating further evidence. Specifically for HIV healthcare professionals, including, as I mentioned, including mental health support as part of HIV care would be critical, as well as identifying and implementing tools for triage of mental health symptoms or disturbances and ensuring proper support for people who present with mental health symptoms or mental health disturbances. Fostering the creation and scale up of referral networks, which include both professional interventions and these lower threshold interventions, which can be beneficial for people who do not have very serious mental health disturbances, or who can benefit from them despite having a more serious symptomatology. As a complementary intervention would also be very welcome, and naturally improving communication between HIV specialists and mental health professionals is one of the essential steps moving forward. Also, we believe that training for healthcare professionals in order to better understand the context that many people living with HIV live in, and some of the stigma that they are subject to, which also has a role in mental health, would be absolutely critical. So these are the acknowledgements. And thank you for your attention. And these are the links for the full and short survey report. And we're available for questions and comments. Thank you very much.